Hi, everyone. Thanks so much for inviting me. I know we're running really late, so I set my timer for 10 minutes. So I'm going to go really quicker than they even asked me to. And the one thing that I want to talk about is, I just started off something that we really haven't talked much about today, which is about families. And I really believe that families are a crucial component in ensuring that our veterans are living high quality and fulfilling lives. So I'll show you some data to support that. Or I could just leave if we all agree that families are important and we should support them. So 1 minute. But let me tell you a little bit about our institute. RAND has a history of doing nonpartisan, it's a nonpartisan nonprofit research organization. We have a history of doing research on veterans issues. The Institute was formally established 3 years ago, and our mission statement is to conduct research that improves the lives who served and, importantly, those who support them. As I mentioned already, veterans' families are critical to veterans' well-being, but we've done really very little research to actually understand the experiences of our family members. I want to set some context. We actually produced this last year because the data didn't exist. So we defined a veteran household as a household in the United States in which there's at least one veteran. So 11.4% of American households are veteran households. So it's around 10% of all households in the US have a veteran. To give you a description of those households, 2/3 of them are veterans married to non-veterans. We have around a quarter, 29%, who are single veterans, and I want to get to that point a little bit later. Then we have some veterans in partnerships, and a much smaller group, around 3% of veterans who are married to other veterans. For the one about veterans married to non-veterans, or just married in general, one thing that we have in the data that I don't have the slide for is that around 53% of veterans married their spouse after they left military service, which means we often assume that a lot of veteran spouses have had that shared military experience that the veteran had, but we actually find the majority of veteran households, that spouse actually doesn't have that military experience. They came in after the person had already left the military. So how well are we supporting military families? That's a really broad question that I don't have time to get into all families, but I do have time to get into a specific group of families, and that's military and veteran caregivers, a term that we've termed with the Elizabeth Dole Foundation, America's Hidden Heroes. And what do I mean by caregivers? I mean by individuals who are caring for veterans and service members who are wounded, ill, or injured, and who require outside support. Now, this could be a lot of things. This could be things like helping inserting feeding tubes, helping with mobility challenges, but it could also mean driving somebody to medical appointments, or in the case of PTSD or some other mental health conditions, just helping people manage their mood, or just being there if they had a panic attack so that you can take that phone call and kind of help them through that attack. So based on our study, we conducted a nationally probabilistic survey of the American of the household population. And we identified that there are around 14.3 million military and veteran caregivers. So these are individuals who are caring for those wounded, ill, or injured service members or veterans. This gives you a sense, because many of them are families. So I've broken it down to the top is those who are caring for somebody who's over the age of 60. And you can see the majority, 42%, are adult children who are taking care of their aging parents, right? We can't forget that a lot of veterans are old. Actually, the majority of veterans in today's society are older veterans. And so we have a lot of, and this is me, my mother was diagnosed recently with dementia. She's not a veteran, but I'm taking care of her. I'm her caregiver, so I fit in that 42%. But we also still see around a quarter of them are spouses. But those who are caring for somebody under the age of 60, we still see around 25% spouses, but we see 27% neighbors or friends, and we see 31% who are other relatives. These are people like siblings, aunts or uncles, nieces and nephews. Remember when I showed that slide before that we have 29% of veterans who are single. So these are, we're trying to think about the family as a holistic group. Now in our survey, we asked, how concerned are you that the person that you're providing care for is at risk of suicide? And 9% of the military and veteran caregivers we surveyed said that they were somewhat or very concerned about suicide risk among their veterans. And this gives you a sense of some of the things that they told us. Here at home, I have to have all his medications locked up in a safe because he has tried to take his life before. And one of the things he has done that with is medications. My biggest challenge is to make sure that he doesn't try to take his own life again. So let's give you a sense of who are these individuals, the care recipient. So this is not the caregiver. Here I want to talk about the care recipient. So the blue represents those care recipients for whom the caregiver is worried about suicide. So 55% of those care recipients are under the age of 60. 48%, nearly half, have access to a firearm. And that might in fact be the reason why the caregiver is concerned about suicide risk. In 40% of cases, the care recipient has been diagnosed with TBI, and in 75% of cases, the care recipient has a behavioral health issue. So not necessarily all cases, which is quite interesting. But I just want to highlight right now, because we often talk about the veteran, but this has spillover effects to their families. So on the left-hand side, these are caregiver outcomes who are concerned about suicide risk among the person they're caring for. And you see, relative to those caregivers who are not concerned about suicide risk, 2/3 of them, a majority of them, have what we would call excessive caregiver burden. 78% have high stress. We call it caregiver elevated perceived stress. 55% of these caregivers themselves meet criteria for depression, and 2/3 of them meet criteria for what we would consider hazardous drinking. We also asked about mental health treatment, and many of them were accessing mental health treatment. This is, again, among the caregivers. We've already demonstrated that they have a need for treatment. But our caregivers in the green represent those who are caring for someone 60 or under, in the blue, those are over 60. We see 36% to 16% said that, yeah, I needed mental health care, but I didn't get it. And I want to highlight two of the reasons, because often we talk about cost. But the primary reason, especially among those younger caregivers, was time. They didn't have the time in their minds to get mental health treatment. So it's not that it wasn't available, it wasn't that it was too expensive, it's just that it didn't fit in their schedules. The other concern, and we heard this talked about earlier, is hospital and medication concerns. We rarely talk about this, but we don't really have honest conversations about people who are considering mental health care. A caregiver, after I gave this presentation before, was caring for her husband with ALS, which you know is a terminal disease. And she said, there's no way I would have gone to seek mental health care, nor would I have admitted to having suicidal thoughts, because I was worried that I could be deemed incompetent to care for my husband and that he would be taken out of our home. People have huge concerns about if they are honest or accessing mental health care, what list they'll go on. And I think that we all know right now, especially, that concerns about being on lists is quite real and valid. So we thought about different ways to address caregivers' unmet mental health needs, and I just want to highlight 5 of them. Collaborative care is an evidence-based approach that integrates mental health care into primary care and has been found effective, and we think that this could really help caregivers. Telehealth is another option, and I have to say, the VA right now has a pilot where they're offering telehealth to a subgroup of caregivers, and the reason that's so actually novel is because the VA really doesn't have the authority to care for other people other than veterans. So during COVID, they started administering vaccines to family members, and now they're offering this pilot telehealth program to address the mental health needs of caregivers. Asynchronous counseling for low acuity mental health concerns is kind of like text message-based counseling. There's some really promising mobile health applications. Some of them need to be evaluated more, but I'm really excited about some of the, especially for things like PTSD coach or CBTI for insomnia, that could be helpful. And then task sharing. This is where you assign, especially for low acuity mental health needs, you provide kind of low-level mental health skills, psychoeducation, motivational interviewing to non-licensed mental health clinicians, but people who might be more likely to interact with patients. And generally, we just finished an implementation study where we did task sharing with peer mental health support specialists, and we embedded them in rural libraries in Texas to extend mental health outreach. And I have to say, everyone thinks it's generally a good idea. Some of our biggest people who oppose it, oh, I'm done, I'm leaving. No, some of the biggest people who oppose it are actually some of our licensed mental health professionals. And I'll just end with this quote. I can tell, and this is something that we hear all the time, that there's never gonna be a one-size-fits-all solution. And I do a lot of work with suicide prevention, and I believe this for suicide prevention too among our veteran community. We have to start pretending that there's a monolith, that everyone's gonna wanna meditate, that everyone's gonna go out and run a marathon. These are groups of people with diverse needs, and we have to tailor our approaches to respect that heterogeneity. And we see this in our caregiver population as well. I can tell you that my experience has been the same as everyone else. My experience has been different from everyone else. And anyone who's a caregiver will tell you the same thing. We all have the same experience, but we all have very different experiences. So that's where you can get our reports. Thanks so much, I appreciate it.